US COVID-19. UK variant increasing cases exponentially despite vaccine race. A new study unveiled the numbers that show how fast the UK variant is, compared to the original strain of the COVID-19 virus. In the US, the variant has spread already to at least 46 states and Washington, D.C., according to CNN. And with some Americans ignoring personal responsibility, there's a chance that the country's gains against the pandemic may be lost. Dr. Celine Gounder, an infectious diseases specialist and epidemiologist, said, "That strain is increasing exponentially. It's spiking up. So, we are probably right now on a tipping point of another surge." On March 3, a team of researchers led by Nicholas Davis of the London School of Hygiene and Tropical Medicine analyzed the transmissibility of B.1.1.7 lineage of SARS-CoV-2. When the variant emerged in the UK, it quickly took over other pre-existing variants in the country, which surged cases. The surge forced the UK government to enforce stricter rules to slow down the spread. Researchers explained that the variant features 17 mutations, and 3 of those were deletions. Of 17 mutations, 8 were determined in the spike protein of the coronavirus. The key mutation has been the N501Y that allowed the virus to better bind to host cells, while the deletions of deltas H69 and V70 in the spike were associated with immune escape in immunocompromised patients. The deletions were also identified with enhanced viral infectivity in vitro. To determine the variant's growth rate, the team probed the dataset from the COVID-19 Genomics UK Consortium. This dataset contained more than 150,000 sequenced coronavirus samples across the UK. With multiple statistical and dynamic modeling techniques, they were able to measure the growth rate. Results estimated a higher transmissibility rate of between 43% and 90% than the original SARS-CoV-2 strain. That range of transmissibility rate is a concern because the global vaccination rate remains low. Although Israel has topped the charts and the US now has 3 authorized vaccines, the same cannot be said in numerous countries, particularly those in poor regions. While the UK variant doesn't care about the income status of a territory, once it crosses a border, it will do what any virus does: infect and replicate. So, if a country without a vaccine develops local transmission of the UK variant, its economy and healthcare sector will suffer. Michael Osterholm, an epidemiologist and wasn't a part of the study, said that the UK variant accounted for 4% of cases last month in the US. Now, it's accounted for 30% to 40%, showing how fast it could spread.